But again, we are focusing primarily on women. We also have contraception for men.
Right.
And believe it or not, it's easier for men to be the ones on the contraception.
Is it?
Believe it or not,
Right.
you have a less complicated system. Sperm production is a month. It's usually in 3-month cycles, and so you know exactly when to inhibit it. As whereas a woman, it's an egg or a bunch of eggs being recruited every month, and one being shed or lost every month if you don't get pregnant. So the cycle or the system in the woman is a bit more complex than in the man. Granted, because women are the ones who carry the burden of childbearing and looking after the home, the contraceptive burden is carried by women as well. But it would help if our men would help us.
Yeah, I kind of think it should change. Although naona hapa already kuna amana na niangalia like sema tusikie. So for men, what options are there?
So for men, we start with the very basics, barrier methods, the condoms. So those are easy to use, just requires discipline mainly. And there are different types and different styles of them now. So even for those who have allergies to latex or to the rubber, there are non-latex versions as well. There are different ones in terms of lubrication, in terms of sensitivity. So some people say they don't have sensation when they use condoms. We have lighter ones that have been produced. So you just need to look around in the market and see what works for you. Then the next one is the common but also very notorious for failure is the withdrawal method. And that requires a lot of discipline, but also you have to keep in mind that there's such a thing as pre-cum, and so you can have some sperm that's released before ejaculation. So it's one of those that you have to talk about with your partner as well as with your doctor, because it works really well if combined with somebody who's on another type of contraceptive or is on natural contraception and knows her safe days, then it can be used effectively. Then there's what you consider more permanent option, and that's when you're completely done having children, which is a vasectomy, like you've said. For some reason, men are really afraid of this procedure.
There was a little test that was I conducted via somebody else. So there's a group where they're predominantly women and mothers, and I asked them, go ask your husband or partner about the answer. Uchawi. Kwani haunipendi. There's so many misconceptions about that.
The main one, I believe, is men believe it's going to affect their ability to perform. And that is completely false, because we don't touch anything to do with performance. It's basically just cutting the tubes that provide the sperm into the ejaculate. So even after a vasectomy, you will still perform normally. You still have an ejaculate. You have ejaculation, but inside that semen, there's no sperm, and therefore pregnancy is not possible. So it's one of those really safe, really easy to do. Believe it or not, it's a clinic procedure under local anesthetic. 10 minutes with your doctor.
What? Okay, I didn't know that. Me, I knew when I go under, you spend a day in hospital.
Unfortunately, it's the women. If women decided to tie their tubes as a permanent method, then they have to go in and be under sedation or a general anesthetic. But for men, it's a local anesthetic that's injected locally, basically pain-free. You have maybe 2-3 days of discomfort where you'll be pampered at home and taken care of like the king that you are. And then you're back to work and you're back to your normal duties and normal functions without any risk of pregnancy. And that's the only thing that changes. So in as much as men are skeptical, I would like to convince them that it's a safe method. And again, I'm insisting it's permanent. Yes, it can be reversed, and there are procedures for that. But of course, that's more labor intensive, it's more expensive, and that does require going into theater and having a general anesthetic. So you need to pretty much be at a point in your life where you're pretty sure I don't want to have more children.
All right.